Paul came. Yeah. All right, I want to welcome everyone tonight. I didn't think that we would be back, but we're back. Gordon Ferguson is here with me. Gordon is the CEO, I think it's the right term, Gordon, of St. Thomas Rutherford, and then we have Dr. David Sellers, who is the Dr. Sellers, why don't you introduce yourself?
So I'm the Chief of Staff at Ascension St. Thomas Rutherford.
Oh, great to have y'all here. Really just wanted to get everyone back together. Gordon and I were just talking, I think it's been over a year since we got back when we really were dealing with some of the things as COVID started back in March, April of last year. I know my first briefing that I did, Dr. Patel came in from Murfreesboro Medical Clinic, and we sat and really just talked for 30 or 45 minutes and have tried to routinely do these. I thought it was appropriate that with the Delta variant and the things that we're dealing with inside the community, our school systems, what I want to tell the residents who are watching, as much as this COVID discussion has taken place over the last 18 months, it's hard not to see really the divisiveness that is within the discussion of COVID. And what I want to make sure the people who are watching tonight understand, the three of us who are here, we have no political motives. This is not a Republican or a Democrat thing. We're not going to get into all the other periphery things. Really what I want the community to understand is what the hospital is seeing, what they're seeing regarding the Delta variant, the people that are in the hospital who are sick right now, where we are capacity-wise, and then also talk about what you're seeing between vaccinated and unvaccinated. So, Gordon, I want to thank you for coming, and really, as the people who are watching, if you have comments, I'll do my best to get those answered, especially with Gordon and Dr. Sellers, who obviously know way more about this than an elected official would know. So, Gordon, the floor is yours.
Thanks, Mayor McFarland. I appreciate giving us the opportunity to come and share some of our views and updates on where we are with the coronavirus. Like you said, we'd much rather not be here tonight talking about this again. But I think, as everybody knows, we have seen a fairly significant uptick in the number of positive patients, positive residents of our community that have picked up this latest virus. We went through the spring where we saw our numbers decline, and we were excited that at one time we were down to single-digit numbers. And then we started hearing about this Delta variant and how easily it was to transmit from one individual to another. And so in the, beginning in July, we started to see our numbers of positive patients increase. And we actually were noticing that it was a younger population of patients that were coming through our ER. And so, again, as I think we've heard through various media outlets, hospitals across the country are really been inundated with a good number of COVID patients. I will say I think we are not being hit as significantly as maybe some of our surrounding states. I know that we've in Ascension have got several hospitals in Florida and Alabama, and they've really been hit hard. That may be coming our way, but right now I don't mind sharing with you that today, when we started today, we had 125 COVID positive patients in the hospital. Now that number is probably different today. It might be a little bit less, it might be a little bit more, but it's a constantly moving number. Of those 125 patients, we've got 20 in the critical care unit. Our critical care unit's a 32-bed unit So having 20 COVID-positive patients in the unit is significant. And then of those 20, we've got 17 that are currently on a ventilator. So I would say, again, we are seeing a younger group in the hospital than we were seeing a year ago. I think what's most important about this, well, first of all, it's easy to talk about numbers, but when you actually see these patients, it really does give you a perspective. I have walked through the hospital a couple of weekends and deliberately walked through our intensive care unit, and to see the number of patients there that are fighting this battle, the staff that are there doing their level best to take care of these patients is it's really something I wish more people could see, to kind of put kind of real people behind the numbers. But I think what is also significant is the fact that about 95% of the patients that we have in our hospital have not been vaccinated. So there's a very clear differentiation there between those that have been vaccinated and those that have not. And granted, there are these breakthrough cases, and I know Dr. Sellers can talk about that much better than I can, but you know, I don't think it's right to say, well, the vaccination is not working. I think you can have these breakthrough cases, but more often than not, these cases are much more mild cases than those that have not been vaccinated.
There was a question, Gordon, that was just asked, because of the Delta variant, what is the benefit of being vaccinated?
Again,
or Dr. Sellers,
I might let Dr. Sellers handle.
Repeat the question, I'm sorry.
Because of the Delta variant, what is the benefit of being vaccinated?
Well, we're seeing that in our hospital, 95% of the patients who are sick enough to be in the hospital have not been vaccinated. And the 5% that have been vaccinated, that have breakthrough cases, we notice that they're not as ill. I mean, they have shorter hospital stays and they go home, and they don't get as ill as the people who have not been vaccinated. So even though we know that this is overwhelmingly the Delta variant that's causing these illnesses now, I say that the vaccine is doing its job for the large majority of patients.
And Dr. Sellers, what are you seeing from your standpoint as Chief of Staff? And Chief of Staff, you're really monitoring a lot of what the other doctors are seeing, consulting. What are you seeing overall that's different between now and really 6 or 8 months ago, or even 5 or 6 months ago?
Right. Well, like Gordon was saying, we're seeing a much younger population in our hospital. Unfortunately, people do succumb to this illness, and what we've seen from the people who've succumbed is that the average age of those individuals is 52, which is a stark contrast to what we saw back in January, where it was a much older population that was passing away from this illness. So when you think about, we're seeing people that are in their 30s at times that pass away from this, it really hits home, it hits your heart, because you think as a healthcare provider that physicians and nurses, we look at patients and we just, it breaks your heart. You Sure. Just really feel like, I wish this could have been prevented. So.
What are you seeing as far as younger children? And I have two 17-year-olds. They made their choice 2 or 3 weeks ago. My wife is a nurse practitioner. So I defer to her on medical decisions inside our family because that's what she's trained to do. But my 17-year-olds made the decision that they got vaccinated. They've received their second shot. What are you seeing as far as teenagers and even in the younger population?
Well, I know that I'm the chief of staff, but I'm also a hospitalist, so we do take care of patients that are adult age. So I really can't speak to what the emergency department is
Yeah.
seeing from the younger population, because I would imagine that those that are sick enough to get hospitalized get shipped to Vanderbilt or to Centennial Pediatric in
Right.
Nashville.
How reliable, I'm going through questions. How reliable are the rapid tests between I guess, is it PCR? Is it the actual test that you take and send off, that's PCR, is that right? Or
Right.
and then the rapid test, what's the difference in between those two?
So the rapid test is not as accurate as the PCR. The PCR is going to give you DNA testing, so it's going to be, the sensitivity is going to be in the high 90s percent. The rapid testing is more in the 70-80%
Okay.
range. And so I would say for people who get rapid testing, that they really do feel like they have COVID, that even if it comes back negative and they really feel like they probably have COVID, they probably should go further and get the PCR testing.
Okay. All right. Some information. And folks, I want to again tell y'all, you're watching City TV 3. This is not CNN. This is not MSNBC. This is Fox News. We have no bias on this. I just want you to get the information that are from people who live in our community. Gordon, how long have you been in Murfreesboro?
Oh, I think now about 23 years.
So Gordon's been here over 20 years, active in the community, and I think it's important that you hear from people in your community and not necessarily what you're seeing somewhere else that, they're not in Murfreesboro. I mean, I've had this discussion. Our council talks about this, that local decisions should be made, by local people because you see what's happening in your community. And I think it's important for our community to hear from people on the front line and what you're seeing. So the question that we had here, would it be wise for large group meetings? Is it okay to be in large group meetings again?
Well, I can tell you at the hospital, we've got a policy where meetings within the hospital are limited to 10 people or less. We're doing a lot more using Zoom technology and the video conferencing. And we are still very much practicing the basics that we talked about just over a year ago about the importance of hand hygiene, social distancing, and the use of masks. And I know we've all got our masks here with us, but we're
socially
vaccinated,
distancing,
and we're apart. But yes, I do worry when I see a lot of people gathering together, and you just don't know those that have been vaccinated and those that haven't. And again, this Delta variant is just very easy to transmit. And I just would caution people to use common sense and just don't risk it.
Okay. What about the information that's come out over the last couple of weeks on the booster shot? What information have y'all gotten on the booster shot, or what are y'all recommending from that standpoint?
It's still coming out depending on which particular vaccination, but I know at the hospital we typically have mostly provided the Pfizer vaccination, and we understand that that booster would become available for certain population groups toward the end of September, but it's our intent with our own staff to be providing that booster.
Okay. Is there, I know it's hard to keep up with everything that's happening. A lot of the protocols change almost on a daily basis, but I mean, if you were, as you're talking to the residents of Murfreesboro, what would be some of the things that you would really want the residents to know, not just regarding this Delta variant, but really moving forward, what they should do to not only protect themselves, but to protect their families?
I would strongly recommend people to get the vaccine if they're able to. We know that the vaccine works. Also, they should continue to social distance, hand wash, like Gordon was saying, wear masks, especially when you go out in public. I do. When I go to the grocery store, I'm wearing my mask. And I notice some people do, some people don't, but I think it's just to be safe to do that. I know it's very controversial the mask in schools, but I think it would be wise if you sent your child to school in a mask. I don't know if the child will keep it on,
Yeah.
but that's another subject. But I think it would be wise to send them.
And I think what's tough, I'm just speaking from experience. So I have two 17-year-olds and an 8-year-old, and it is so hard with an 8-year-old that has his mask, then he takes his mask off, and then he touches something, and then he puts his mask back, and so I understand and sympathize, and and I think the other part, Gordon, this is a question I'll ask y'all because y'all have lived this almost for 18 months now. As I talk with people in the community, I think I was vaccinated, my wife was vaccinated, my mom and dad. Ashley's mom and dad, I mean, our entire family. Ashley's granddad's at home with I don't think he would mind me saying he's at home with COVID now, and it, thank goodness it's a minor case. Ashley's aunt, who worked here at the city, contracted COVID the second time after having the vaccine. She was in the hospital, but only for less than 24 hours because it was one of those breakthrough cases you were talking about. But what do you say to the person who, and this is what I was talking about, Gordon, that you almost, I think the community has gotten COVID fatigue, that, as the summer has come along and, it's nice weather and people are just, they're just tired.
Right.
So, I mean, what do you tell people besides, look, it's not up for me to tell you to get vaccinated or not. I think, we're all going to be dealing with things moving forward in the future that if you want to do certain things, you're going to have a vaccine. And, my parents dealt with that when they took the polio vaccine and they've got the scar. I guess that was the scars, that smallpox or polio. But what would you tell our younger population and people as we start going through, especially as we get into the fall and winter months?
I think you're correct, Mayor McFarland. We see that fatigue with our staff at the hospital and all they're dealing with, but I still, yes, the mask may not look the best, although I think people have got kind of creative in their coloring of their masks, but it's a little inconvenient. But when you weigh that against the implications of
Sure.
getting COVID and then maybe that progressing into pneumonia, it's just the right thing to do. And I think one of my suggestions would be for our community to really listen to the medical professionals like Dr. Sellers. I know our pediatricians in the community have been very vocal about their thoughts regarding masks, and I applaud the action recently taken by the City of Murfreesboro School Board because I just think it's the right thing to do, and anything that we can do to prevent this from a family member, a loved one, our friends, we just want the public to really know the facts because there is a lot of misinformation out there, and you're correct. Some of the procedures change as we learn more about this disease, but it's something that we just want to do our best to prevent.
There was a question, and I want to also tell the residents, we didn't talk before this started, so I didn't have a list of questions and say, hey, be prepared to answer these. I really wanted to, get your unbiased opinion on not knowing what I was going to ask. But I have a question here that is asking for a family member who took the J&J vaccine, can they, when the boosters come out, can they take Moderna or Pfizer, or is that something that's still being worked through?
That's actually still being worked through right now.
Okay.
It hasn't been determined yet.
Okay. And I'll just point blank ask y'all, are y'all seeing any reactions or anything from anything overwhelming with people who are getting vaccinated? Is there anything that you're seeing?
No. The side effects from the vaccine are relatively minor and the same side effects you get from most other vaccines that we use. but I haven't known of any cases that need to be hospitalized secondary to a vaccination.
Okay. Well, I think we've gone through all of our questions. I'm going to commit to try to get back, and we did this once a week almost for 10 or 12 weeks, and really hadn't felt necessarily the need to do that. But Gordon has been great on keeping all of us up to date on what's happening at the hospital and sort of the capacity at the hospital. How many beds are we at the hospital now, Gordon?
We're licensed for 358.
Okay. So as we get more information, we'll make sure and be committed to get that out to you. The tough thing about COVID, and I've said this to a lot of the groups I've spoke to, it really has taught me, if not only spiritually, but going through as being an elected official, how little control you have over these things. In Murfreesboro, I'm not trying to pass the buck, because I can only imagine being in the situation that the governor's in, the decisions that he has to make, and even going up the food chain to other elected officials. But we don't have a municipal health department. It's a state-run county health department. So all of the guidance that we get specifically comes down from the state. And even on the debate that was going on last week with the school boards, a lot of that guidance is being passed down from the state. So, our commitment, although we can't put protocols in place inside the city, we're going to make sure and get you the best information that we can possibly get you with people who are unbiased and live in our community, who are living it every day. So we're going to make sure and continue to do that. I want to thank City TV3 for doing this. Yes, sir, Dr. Sellers.
There was one thing I did.
Yeah.
Some more numbers but when I saw these numbers, it was startling to me, actually. So these numbers were taken from websites, from the Massachusetts and Tennessee health departments, and everyone can go out and look at mass.gov or tn.gov at these numbers. But these statistics were taken 2 weeks ago on August 16th. And we use a comparison to Massachusetts because our populations are similar. Massachusetts has 6.9 million residents, and Tennessee has 6.8 million residents.
Oh, yeah.
But Massachusetts, 70% of their residents received at least one shot at this point in time, where 47% of the Tennessee residents received one shot. For COVID hospitalizations, Massachusetts, 402, Tennessee, 2,336, 6 times higher. For ICU patients, Massachusetts, 82, Tennessee, 708, 8.5 times higher. And for COVID ventilator patients, 38 in Massachusetts and 519 in Tennessee, 13.5 times higher. So I think that when I saw these numbers, it just was very apparent to me that the vaccinations do help tremendously. Yeah. And I really just wanted people to know those numbers.
Yeah, that's data. I mean, those are not numbers that. Yep. So what I want to say is thank y'all. We're going to do everything we can to continue to getting you the information. Again, we can't tell you anything that happens outside of Murfreesboro and Rutherford County, but I know after listening to, I listened to Lou Caputo with Stonecrest, and I think they are experiencing a very similar outcome on what we have here in Murfreesboro. But folks, I think it's something that your families need to talk about. It's something that we all need to be cognizant about, and as much as we was talking about with the COVID fatigue on really being vigilant again and hopefully getting this taken care of and getting back to as close to normalcy as we can. So thank you all for coming. Thank you for the work you're doing. And Gordon, please let your frontline people know how much we appreciate them and how much they're taking care of Murfreesboro.
Thank you, Mayor. And I do want to offer my words of appreciation to this community for rallying behind our staff. We've had kids come back to the hospital just last week outside and chalk our sidewalks, and kids at St. Rose send us a video message just in support of our caregivers. And I would say just appreciation to all of our first responders, and healthcare is tough, but people have got the right heart, so we appreciate the support.